Well, I think they are becoming more important. I think it's very much something, groups need to reflect their particular surgery, their particular patients and needs. And I think as a group, we are more and more finding a role for ourselves and hopefully being more important to the surgery. I mean, at the moment, we are a conduit between the surgery and patients and the surgery. And that's pretty useful, I think.
That's a tricky one to answer because we do work directly with GP services, in as much as there are some of our community services are run from GPs' surgeries. So for us, it's all about footfall. So that's as much as I think I can answer that one.
I think so. I mean, obviously we
don't have specific groups.
No, but having patients' feedback on the kind of services they want in the community is really useful for us. So I guess the patient participation groups are a really important part of understanding that.
Because any community service that we set up is, we try to bespoke to what that community particularly wants, and so when we make that first point of contact, or often it's me making that first point of contact in the community, the GP surgeries are the place, that my kind of first place to go to. So yeah,
I've no idea, but I should imagine that they are important, yes, particularly ones which are perhaps rather large and you don't meet people. Yes, I'm sure that you don't always know what's available and what's going on and what people there are, so I'm sure that is important.
Well, if it's like this, a lot of people will probably stay away from the doctors and go through another channel. But I think one of the important things with the surgery is that people keep their appointments. And if they do that, because it costs £160 every time you miss your appointment, that would help out the doctors if somebody have got problems.
I hadn't a clue, I didn't even know there was one. And I've been with this practice for 43 years. I never knew there was a patient group.
Very important, because I think the GP surgeries need to know how people feel about them, because if you're not happy with the service, you're very quick to tell other people. Very often when you're happy with the service, you never pass it on. And they need to know to keep their finger on the button.
Very good, very useful, yes.
I'm sure they're very important. I think with the size of some of the surgeries now, it's rather difficult to get representation across all different areas of the community. So exactly what feedback the surgeries get may be simply determined by the random selection of people who come along to the patients group.
I think they're very important, especially if they do something like this. I think that's really good. Yeah. Well, it gives them a platform to provide a decent link, and I think that's the first thing, and that's very important. Speaking personally, I think the GP surgery in Carnon Downs were very, very lucky. They're very helpful, and I've found them very communicative, and they're very good at listening. But I think it's important to have that partnership between the surgery and the public if we're going to promote health and get the best that we can out of it. Yeah.
Well, at Carnon Downs we believe they're very important. We want it for them to be supportive to the surgery and almost like a link between the surgery and the patients. They're very good at sort of sharing information, but we particularly wanted their role to be to do just that, share information, which is part of today, but they've also done things like do patient surveys for us and stand in our foyer and hand out different information, and it works very well. But we're very lucky we've got an active group and they're very keen to do something.
Patient groups are really important, but I suppose ultimately what you're looking at with a patient group is that you're trying to have a two-way conversation with your patients in terms of hearing what they want to tell you about the practice, good and bad, and also us being able to then pass through to patients what we feel is important for them to know or to help them understand what we do or how to make things work better. So I think the idea of them is really good, and technically it's the right thing to have. What we find in reality is that it's very difficult to know how you get a true patient group. How do you connect? How do you get people that are representative or who can communicate with, so we've got 5,500 patients. How do we actually communicate to hear from that group and to pass information through to them? So our patient participation group is very active and is very good, but you're always asking the question, are we only managing to communicate with a very small number of people? I haven't got the answer to that yet.